in the middle of the worst measles outbreak in decades, and a new study says sugar may not make your kids hyper as you think. Dr. Richard Chaffoo is here to break it all down. Oh my gosh, I'm about to sneeze. Excuse me.
Bless you.
Thank you. Okay, doctor, hold on. I said, hold the phone. I know so many parents who say, don't give the lollipop to the kids, or don't give them the sugar. They're going to get hyper. You're saying this is not really true.
It may not be the case, Kristina, because a fascinating study that came out in the JAMA in the late 90s actually reviewed 16 pretty good clinical studies and looked at, is there an association between sugar and hyperactivity in children? And in none of those studies could they show a direct causal relationship between the two.
So why do we have that type of perception then? It's a parent perception?
It is a parent perception. Another fascinating study was done relatively recently where a group of researchers took a group of kids and divided them into two groups. One group, they gave them a sugar substitute drink, but they told the parents ahead of time, look, this is a sugar substitute drink. We want to monitor their activity. In the second group, they didn't tell them that. They said it's a sugar drink. And the group where the parents thought the child had gotten a sugar drink, they actually monitored these kids and said, well, they have a higher hyperactivity level. There was more activity. So part of that may just be our perception, but perception doesn't always necessarily equal reality.
So, but is there a way for parents to see if like their child is sugar sensitive, or?
There is a way, and you know, one thing that you can do is gradually reduce or eliminate sugar from a child's diet over say a couple of week period. And then after that period of time, if you add a small amount of sugar and you see there's an increase in activity level, then there may be some sensitivity, although that's only been seen more in kids that have ADD. And the problem with giving sugar and saying sugar is causing all these problems is most often when they're getting these sugary drinks or sugar is they're in activities that are very hyper. For example, they might be at a birthday party, a celebration, they might be out with their friends, and so we're releasing more of our own epinephrine, which we know is one of those fight or flight hormones that makes our heart rate goes up, increases blood flow to our legs, and makes us a little more twitchy. So it may not really be the sugar that's a causative factor. It may be that the kids are just more excited in the environment in which they're looking.
Interesting. Okay, well, what tips do you have for parents anyhow, just so that, you know, we can decrease, you know, the sugar intake?
Of course.
For kids?
Well, the big thing that has come out, the American Heart Association says, look, you want to reduce sugar consumption in 2 to 8 year olds between less than 6 teaspoons a day.
Oh, wow.
So what we want to do is we want to limit the amount of sugar that a child is getting. Obviously, we want to, if we're having a regular meal, then we want to make sure that the sugar is coming along at snack times, not as demand feeding. So you want it to be on a schedule. And if you're able to substitute a sugar food for a healthy food, then that's a better decision. So if you're going to a party, maybe taking a fruit tray or taking a vegetable tray with some hummus or some other little dip. If the child's going to get ice cream, maybe pair that with something that's healthy, like some granola on the top versus the sprinkles. If they're getting cookies, give them milk, or birthday cake, give them milk versus a juice bar. So don't double up on that sugar content.
And they all love it. They all love the sugar. Okay, let's touch on this real quick, because we've been talking about measles for a few weeks now, and how is it that we are in the middle of this measles outbreak, and since it was eradicated from the country in 2000?
It was, and the problem, unfortunately, Kristina, is there's been a lax in parents vaccinating their children, and what we found was, as parents aren't vaccinating their children as they should be doing, we're seeing more of these cases now, mostly between other people that have not been vaccinated or in adults that didn't get their vaccination when they were young.
Okay, Doc, before I let you go, just one more question. Now, for those of us who were vaccinated years ago, before 89, do we have to get vaccinated again?
Well, the take-home message, you really want to check with your physician, Kristina, because, you know, since 1990, that outbreak, we've recommended MMR for 2 doses. Before that, it was 1 dose. And actually, between 63 and 67, the vaccine probably was not very effective. So there's not a lifetime immunity to many of these immunizations. My daughter, just on a personal note, a couple of years ago, was having a really bad barking cough. And of course, all my kids have been vaccinated. I've been vaccinated. And so after about a week, we took her into the pediatrician. The pediatrician said, maybe she's got whooping cough. And I said, well, wait a minute. She's been vaccinated for that. Well, the vaccination only works for about 75% of the time, and it's not lifetime immunity. Sure enough, she had whooping cough. So it's important, I think, as a parent to be very proactive, aware, and remember that the vaccination that you deny your child doesn't just have health implications for your child, it has health implications for other children and older people that live in your family, like parents, grandparents.
Okay, but better to be proactive.
Always.
Okay.
Yes.
Thank you so much,
Thank
Doctor,
you,
for being here
Kristina.
this morning.